Welcome back in. Diabetes, it's something a lot of people deal with, no matter their age. Dr. Lindsey Rauch is a pediatric endocrinologist with Nationwide Children's Toledo. She joins us this afternoon so we can learn a little bit more about the differences between kids and adults. Thanks for being here today.
Absolutely. Thanks for having me.
First of all, we should note that November is Diabetes Awareness Month, right? So it's a good time to talk about this topic because sometimes we might think diabetes type 2 with adults, but kids are affected quite a bit here too. But maybe more so type 1 than type 2.
Yep.
So let's talk a little bit about the differences.
Yep. So if you look at diabetes in general, it's kind of a catch-all for several different types, basically meaning that patients don't have enough insulin. And insulin is really important to help regulate blood sugars. So type 1 is more of an autoimmune process where the immune system attacks the cells in the pancreas that make insulin, and little by little, the kids just can't make insulin anymore. Type 2 is a little different, that it usually starts with insulin resistance, where insulin just doesn't work as well in the body, and then eventually gets to the point where it just can't make enough, and diabetes can develop.
And you mentioned an autoimmune disorder with type 1 specifically, so there isn't much these kiddos can do to change their diet or change the lifestyle but so medications and things like that they'll need for that treatment.
Absolutely, yeah. With type 2, we have some different options for different pills and different things, but with type 1, pretty much insulin replacement's the only thing that we have.
Okay, so if families at home, because I think sometimes with kids, they can't necessarily tell you what's going on with them, or something doesn't feel right, or I don't know, different things. How do parents, what kind of symptoms, what kind of signs should they look out for with that?
So the most common signs are going to be an increased thirst and increased urination. Sometimes that'll show up in kids who used to be dry at night, starting to have accidents overnight. Sometimes kids will also become much more hungry or even a little bit less hungry. Those are kind of the biggest symptoms that parents see.
And these symptoms can develop with like toddlers, right? I mean, young kids.
Yeah, absolutely.
But they're pretty resilient, aren't they?
They are. They are. It's amazing.
They're good sports about it. And I remember a friend of mine had type 1 diabetes, and she said she was so thirsty she would have dreams that she was drinking a bathtub full of water. You know, so as you mentioned, that increased thirst, maybe those accidents, things like that might be unusual for them. But they're not exactly going to tell you that. Oh, Mom, I'm feeling a lot more thirsty than normal today. They probably won't say that. So how can families support their kids once that diagnosis is made?
We try to get families to help their kids get back to the new normal as quickly as they can. We still want them to do all the sports they like to do, all the activities they like to do, getting engaged in some community, efforts for diabetes camps and things like that to get to know other families to kind of cope with that. But we want them to do everything that they already enjoy doing.
They normally would. So I think over the years, because it used to just be that you were giving yourself shots of insulin, testing your sugar, your blood very regularly. What kinds of technologies do we have out there now?
Yeah, we have had so many advances in technology. It's been amazing. I've been doing this for 12 years, and I just can't even believe how far things have come. So kids can, most kids now wear sensors that check their blood sugar continuously and can go to a phone, and then parents can follow those blood sugars so that when they're not with the kids, they can see what their blood sugars are. Insulin pumps deliver insulin continuously, and the pumps can now talk to the monitors and adjust insulin. It's amazing, and it's really cool to see. I'm
sure a lot of families, though, say, oh, that sounds expensive. Hopefully insurance companies out there take care of a lot of this.
Yeah, they're really pretty good about it. Years ago, it was harder to get things covered, but now they're really pretty good, and we can usually get families the technology they need to have success with this.
So when a parent goes in for maybe to see the PCP for that annual physical, that annual checkup, I would imagine that's a good time to bring up any concerns you might have.
Any concerns if they've been seeing any of the symptoms, bring them up, or any time in between. If you think, man, my kid's just been, something's off, they're just peeing a little bit more, or we couldn't drive our hour-long road trip without stopping 5 times to go to the bathroom, then that would be a good time to go see the PCP.
Unusual for them to bring that up. And then they would get a reference to someone like you.
Yep, absolutely, yeah.
And then is this something where the kids would have to see the specialist pretty much through their adolescence and then into their adulthood?
Yeah, so we'll typically see our kids every 3 months. And then we'll keep them on, depending on the practice, through high school or college, depending on how long they want to stay, and then they would transition to an adult endocrinologist.
Very good. So you hear here that the technologies are out there. These kids can have really fun, exciting lives and keep up with their hobbies and all of that. But if maybe some of those symptoms sound familiar to you, maybe it'd be time to get them into the doctor.
Yep, absolutely.
Thanks so much for being here.
Thank you.